Okay? Bed sores. Come in a lot of different sizes and shapes. Usually in the center of the back or right here on the pelvic area. It's a perfect reason why you need a survey. I just showed you that we turn the body by putting your hand here. I'm on this side. I'm washing on this side. I don't know what's doing here. I can't see. So as you're undressing the body, you want to let everybody know there's the beginning of a bed sore here. There's a blister. There's very sensitive skin. I'm sorry I keep looking this way or that way, and I haven't been looking to you guys, so please forgive me. Now, so you let people know that there is a sensitive area here. And before you turn, the person on the other side will tell you, hold over here, or hold over here, rather than right on that spot, okay? Now, if you don't touch it, very often nothing happens. Sometimes there are dry bed sores. It's like almost like a scab color. Don't touch it. Let it be. It'll be fine. Sometimes there are huge holes. I would try to remove the packing that's there, certainly the covering of what's there, and the packing that's inside, just replace it with a cotton. Take warm cotton. You can put them on cells on the cotton. First get rid of all the junk that's there and clean the area. Always clean the area before you do anything. And then pack it inside. Now when you pack it, it's not the hole that you see. Where the blood is coming from is all around the inner edges of that hole. Because the hole is just on the outside. Underneath it's much deeper. Underneath it goes much deeper than what you see. So you want to insert it with the edge of a hemostat. I probably would try not to use the scissors in this type of situation, but a hemostat will work fine. Or sometimes, even if your hands have gloves on it, even with your hand, if it's that big, you can just push it in alongside the whole perimeter. Okay? If you feel it would help to pack a little more in the center, fine. And here, nowadays, I would say the best thing to this is using the largest tegaderm you have, and just cover the entire area with tegaderm. Dry it again if you have a body turned the way we showed you. It's so much easier to work. Everything is flat. Everything is straight. Dry it, then just cover the entire area with that plastic. It'll stay. Okay? That's the way to deal with it. All right? You can put the body in the mikveh. You can leave it there afterwards and dress it, and it'll be fine.
At times the body comes with tegaderm already on it.
Excellent question. If it's on a bed sore, and you're pretty convinced that if you remove it, you're going to have to deal with a lot of issues, and it's really fine the way it is, not leaking, which is very uncommon, by the way, I would probably leave it. I'm very honest with you. In a bed sore situation, where you have it most frequently is on the hand with this blistered skin, I would remove it, because very often you see a big puddle of blood here, which in the tower process, in the dressing process, might very well begin to bleed. Okay? I would probably remove it very gently, and sometimes one of the tukunim we had recently, which is a very nice addition to our little set of tricks, is that as you start removing it, take a Q-tip, dip it into nail polish remover. And as you start taking off the plastic, just go along with the nail polish remover. It dissolves the plastic as you go. If necessary, put it at the other end and get some more nail polish remover and just very gently go over it. Some people say shampoo works, other things. This works exceptionally well. This way you're not going to tear the skin, and very often as you remove it, there's almost nothing. There's a little tiny speck that you put a drop of Moncells on, and it's perfect. So I would remove it that way as a general rule. In a bed sore, you have to make a decision. I'd say most of the time I would probably remove it, but if it's really perfectly closed, I probably would leave it. Yeah?
The difference between when you explain the difference between when there's like a tegaderm where you can see what's going on underneath, and sometimes it's a flesh-colored, harder type of bandage, harder plastic.
Oh yeah, no, that's a whole different thing. Tegaderm is see-through and very soft and very simple. There are harder plastic pads or that looks like it's thick, actually has a thickness to it. And those very often are much harder to remove without tearing skin. Again, if you do the same thing, it might work. If you see that the skin is tearing and you can't stop it, I would leave it. Okay? But other than that, I would try to remove those as well. Because very often when you're removing those things, there's nothing underneath. They put this on as the skin begins to deteriorate. Depends on which level you're at. What happened when the person died, how long they were before they were refrigerated, and so on and so on. So I would always try, if you see that you're tearing it, I would try to use this. If that doesn't work, I would leave it. Okay? You know you're going to tear it off and the whole skin's going to come off with it.